Endoscopy. A surgical sinus endoscopy includes a sinusotomy, when appropriate, and diagnostic endoscopy. Codes 31295, 31298. Describe dilation of sinus ostia by displacement of tissue, any method, and include fluoroscopy if performed. Stereotactic computer assisted navigation may be used to facilitate the performance of endoscopic sinus surgery, and may be reported with 61782. Codes 31233, 31298, are used to report unilateral procedures unless otherwise specified. Codes 31231, 31235. For diagnostic evaluation, refer to employing a nasal sinus endoscope to inspect the interior of the nasal cavity and the middle and superior meatus, the turbinates, and the spheno-ethmoid recess. Anytime a diagnostic evaluation is performed, all these areas would be inspected and a separate code is not reported for each area. To report these services when all of the elements are not fully examined. Judged not clinically pertinent, or because the clinical situation precludes such exam. Technically unable. Altered anatomy. Append modifier 52 if repeat examination is not planned, or modifier 53 if repeat examination is planned. Endoscopy. For endoscopic procedures, report appropriate endoscopy of each anatomic site examined. Laryngoscopy includes examination of the tongue base, larynx, and hypopharynx. The anatomic structures examined with this procedure include both midline, single anatomic sites, and paired structures. Midline, single anatomic sites include tongue base, vallecula, epiglottis, subglottis, and posterior pharyngeal wall. Paired structures include true vocal cords, arytenoids, false vocal cords, ventricles, piriform sinuses, and aryepiglottic folds. For the purposes of reporting therapeutic interventions, all paired structures contained within one side of the larynx-pharynx are considered unilateral. If using operating microscope, telescope, or both, use the applicable code only once per operative session.